Assalamu alaikum wa rahmatullahi wa barakatuh. I will talk today about telemedicine and business intelligence. The course name is Database Management System, and the course instructor is Dr. Maqsood Mahmoud. My name is Dhayfullah Al-Taybi. Introduction. What is telemedicine and what is business intelligence? Telemedicine allows healthcare professionals to evaluate, diagnose, and treat patients at a distance using telecommunication technology. The approach has been through a striking evaluation in the last decade, and it is becoming an increasingly important part of the American healthcare infrastructure. Business intelligence is a set of process, architecture, and technologies that convert raw data into meaningful information that drives profitable business action. It is a suite of software and services to transform data into actionable intelligence and knowledge. Database. What is database? Is an organized collection of data generally stored and accessed electronically from a computer system. Where databases are more complex, they are often developed using formal design and modeling technique. Database management system is a software that interacts with end user, application, and the database itself to capture and analyze the data. The database management system software additionally encompasses the core facilities provided to administrate the database. History of telemedicine. What we are recognized as telemedicine today started in the 1950s when a few hospital systems and university medical centers started to try to find ways to share information and image via telephone. In the early days, telemedicine was used mostly to connect doctors working with a patient in one location to a specialist somewhere else. This was a great benefit to rural or hard-to-reach population where specialists aren't readily available. Benefits of telemedicine. Using telemedicine as an alternative to in-person visits has a host of benefits for patient and provider alike. Patient benefits. Less time away from work, no travel expenses or time. Provider benefits. Increased revenue, improved office efficiency, better patient follow-through and improved health outcomes, fewer missed appointments. Three common types of telemedicine. Interactive medicine, which allows patients and physicians to communicate in real time. Store and forward, which permits provider to share patient information with a particular in another relation. Remote patient monitoring, which allows remote caregivers to monitor patients that raised at home by using mobile medical device, collect data, example blood sugar and blood pressure. What are the disadvantages of telemedicine? Unclear policies. Because technology is growing at such a fast pace, it has been difficult for policymakers to keep up with the industry. There is a great uncertainty regarding matters like reimbursement policies, privacy protection, and healthcare laws. In addition, telemedicine laws are different in every state. The second disadvantage is fewer face-to-face. Several physicians and patients are finding it difficult to adapt to telemedicine, especially the older adults. Physicians are very concerned about patient mismanagement, while advances in medicine have made it more efficient to use technology. There are times when systems occur. There is also the potential for errors as technology cannot always capture what the human touch can. The last disadvantage of telemedicine is technology expensive. Healthcare systems that adopt telemedicine solution can attest that it requires a lot of time and money. Implementing a new system requires training and sometimes staff members find it difficult to welcome this change. Practice managers, nurses, physicians, and more have to learn how to utilize the system so the practice can see the benefits. Although telemedicine is expensive in the beginning, healthcare systems should see a positive return on investment over time due to more patients and less staff. The future of telehealth. What is the future of telehealth or telemedicine? Millions of Americans receive care using telemedicine solution and the numbers are increasing. With more patients using the services and more physicians offering it, telemedicine has no choice but to expand. Telemedicine across borders with technology becoming more robust. The future of telemedicine could include international collaboration. Some countries offer medical advances that the United States does not have readily available, but telemedicine would lessen the barriers. Application of telemedicine. Follow-up visits. Using health software for routines follow-up visit is not only more efficient for provider and patient, but it also increases the likelihood of follow-up, reducing missed appointments and improving patient outcomes. Remote chronic disease management. The increasing rate of chronic disease is a major challenge for our health system. It is a prime candidate for the use of telemedicine software because it makes it easier and less expensive for patients to maintain control over their health. Telemedicine system must consist of the following five subsystems. The first one, acquisition subsystem, viewing subsystems, teleconferencing subsystems, communication subsystem, and database management subsystem. The acquisition subsystems collect multimedia information and converts it to standard format. The viewing subsystem displays and manipulates the image and other patient medical information. The teleconferencing subsystems allows face-to-face interactive dialogue between physicians in rural areas and medical centers. Communication subsystems includes local area networks LAN and wide area network WAN to transmit and receive data. Database management subsystems can be connected to a data warehouse. Patient medical information consists of chief complaint, history of illness, result of physical examination. This information may be of the following types: text, voice, still image, dynamic video to design a medical information database for managing a huge amount of heterogeneous data. Textual data were managed by relational database management system, and image data were managed by the operating system itself using external files. The dynamic video may be stored and managed using analog video steps that are usually achieved sequentially in a specific location. In the end, I hope that I provided a good explanation of the subject, and thank you.